question that is sometimes raised about brain aneurysms: which is the best treatment modality? Is it by surgery, clipping, or is it by the vascular catheter, the coiling? Which is better? And simply the answer is there is no competition between both. Of course, by logic, you may think the non-surgical way is better, and I fully agree with that. But when it comes to science, things are more complicated. We can't just give an answer easily and by logic. We have to conduct testing. We have to do a study. The most famous study that targeted this issue was the ISAT, the International Subarachnoid Aneurysm Trial. This trial, or this study, was conducted in the UK and in Europe in 42 hospitals. This study enrolled more than 2,000 cases. And the main goal of the study was to compare the coiling, the non-vascular, the non-surgical treatment, with the clipping, the surgical treatment. And the main point of comparison was which one of these is much safer. The study was conducted from the year 1994 till the year 2005. And the conclusion of this study was that coiling, the non-surgical treatment, is much, much safer. And after this study, there was a shift in treating brain aneurysms from the surgical way to the non-surgical way, because we have data, we have proof that this is safer for our patients. In a couple of years later, a couple of doctors and scientists, they argued about the accuracy of this study. And another study was conducted in the United States. It's called the Barrow trial. And it was very, very similar to the previous study. And surprisingly, the results of the second study was very, very similar, even in numbers, to the first study. And the conclusion was endovascular coiling, the non-surgical way in treating aneurysm, is much, much safer than the surgical way. But as I said in the beginning of the video, this is not a competition. From our daily practice, we find cases that are very, very good surgical candidates. So, to conclude my video, if you are being offered two types of treatment, science and studies, scientific studies, point that endovascular coiling is much safer than surgery. Thank you very much.